My name is Dr. Steve Frost. I'm from Red Mountain Endodontics. I started the practice 24 years ago, and our locations are in Mesa, Arizona. The GentleWave procedure for us has changed our practice in a way that is probably not typical for many practices. We see a lot of emergencies, and sometimes those emergencies are difficult cases to treat. Maybe a patient comes in with swelling, but the efficacy and the efficiency of the GentleWave system allows us to treat those patients in one visit, and where we don't have to have them come back and take a second visit. It's interesting enough that what's taking place in the whole landscape of dentistry, patients are different and their mindset's different. They would much rather have a one-visit root canal than a two-visit root canal. The general dentist now sees us as a viable option for saving a patient's tooth that has had a previous treatment, so like a retreatment tooth, and they trust that we have the most up-to-date technology, that we can implement that technology into, say, a retreatment or a difficult case and save that tooth rather than go straight to an implant or extraction. I had an 88-year-old young woman come into my office last week, and before she got to the front desk, she said, "I was at your website and I saw this new procedure, the GentleWave procedure, and I want the GentleWave." She said it 10 times before she got in the back operatory. You know, it's interesting that for many years, there's been many technologies that have been disruptive that have come out that have changed the landscape of endodontics and root canals in a positive way. I think what's happened with the GentleWave procedure being incorporated in my office, I feel like it's taken me to a different level in my practice to where I've never been before, and I feel like I'm actually becoming a specialist within the specialty of endodontics, implementing this new technology that I'm actually seeing a huge difference in the lives of my patients. So I've seen them, see my enthusiasm, and I think because of that, I think what's the old saying, enthusiasm is contagious, and so the whole office seems to be elevated in our pursuit to help patients have better root canals. The GentleWave procedure, with its research and with its efficacy, really has given me the confidence to go home at night and not think, did I do enough? That the GentleWave procedure is helping me to have better clinical outcomes. But really what that does is that translates down to patients who are more satisfied, general dentists who are more satisfied. Those two combinations really help grow my practice. So what I'm finding is that my general dentist, after learning that we have the most up-to-date and the best technology to save a tooth, I'm finding that they're actually sending their cases to me before they're actually going straight to a bridge and or an implant. Very powerful. Take a risk. Look at it differently. Look at it from the eyes of the patient. If you were the patient, wouldn't you want the best technology possible to save your tooth for the longest time possible?